Hi, I'm Benji Hardy. I've got your Arkansas News headlines for Tuesday, August 18th. Most of the news today concerns Medicaid. A 2-week moratorium has ended on Medicaid terminations. Governor Asa Hutchinson said that the Department of Human Services for the state has eliminated its processing backlog on eligibility verification letters for Medicaid beneficiaries, and the termination process will now resume for people who the DHS has found ineligible or else who have simply not responded to the letters. That means more cancellation letters will presumably be going out soon. A little background here, about 36,000 people were kicked off of their insurance at the beginning of August. Most of those people were beneficiaries of the private option, Arkansas's Medicaid expansion program. Now, another 13,000 are scheduled to lose their coverage at the beginning of September, although that number is likely to rise as more termination letters roll out soon. As we wrote about in last week's cover story for the Arkansas Times, the majority of those people lost coverage not because they're actually ineligible for the private option, but because DHS simply could not verify their income. Many had no income at all, and the verification process was confusing and contained many errors on DHS's part, anecdotal evidence suggests. Worst of all, though, the process only gave a 10-day window for people to respond to the request for more information from the department. Now, that was entirely a policy choice. The state could have easily given people more time to respond, 30 days, 45 days, or even longer than that. All of that and more is why the governor 2 weeks ago called a moratorium on the termination letters. But now that the process will resume, he says the 10-day window should remain intact. He defended the brevity of that window, saying that 10 days, quote, invigorated the process. We've talked to a number of people thus far who have lost coverage despite, on their account, attempting to provide their information to DHS. They say the letters arrived late in the mail. They said they were on vacation at the time the letters arrived in the mail. 10 days just simply wasn't enough time to respond. We'll be continuing to collect those stories in the weeks ahead. Meanwhile, in related news, 2 insurance carriers said that they would take steps to reinstate at least partial coverage for beneficiaries who have lost their insurance. Blue Cross Blue Shield and Centene, which sells in Arkansas as Ambetter, 2 of the 3 carriers that sell private option plans, so they'll reinstate pharmacy coverage for private option beneficiaries. The 3rd carrier in Arkansas, QualChoice, issued no such statement. Unfortunately, that provides no help for other beneficiaries, including some of those vulnerable people. Some people don't have insurance through the private option, but instead receive their coverage through traditional Medicaid, especially the very medically needy population of the state, as well as the other beneficiaries such as children and parents with extremely low incomes are covered by traditional Medicaid rather than private option plans. So if you need pharmacy benefits, if you need medication, you fit in one of those categories, I'm afraid you're out of luck for the time being. Meanwhile, a 3rd piece of news concerning the private option, a group called the Stephen Group, that's a private consultant hired by the state's Legislative Health Reform Task Force, issued a lengthy report that found that the state budget will save an estimated $438 million from the year 2017 to 2021 simply because of the private option. It's worth noting especially that that group was the consultant of choice for some of the most diehard opponents of the program who sit on that task force. Those savings will continue even past 2017, which is the year that Arkansas has to start bearing some of the costs of the private option. At the moment, the federal government bears the full cost of the program, but beginning in 2017, the state will have to start chipping in a small amount. Even in 2021, though, when Arkansas is chipping in a full 10% of the cost, the policy is still projected to be revenue positive. It's going to save the state an estimated $25 million in that year alone. All the more reason to keep it around. Finally in the news, Arkansas Flag and Banner, a store here in Little Rock. The owner of that store, Carrie McCoy, said that the Little Rock store's business had seen a 50% increase in sales over the months of June and July, purely as a result of other major retailers discontinuing the sale of the Confederate flag. She said in a statement in a press release today, "The day that Walmart and Amazon discontinued the sale of Confederate flags, my internet business expanded with orders from all over the country." That's it for today. Back tomorrow.